All right, let's continue our diseases. Again, basal cell carcinoma, least malignant. It is also the most likely skin cancer. About 70% of all skin cancers are basal cell. So 7 times out of 10, when you find that changing mole, it is basal cell. But you do always want to get it checked. With basal cell carcinoma, it is the stratum bacilli cells that are proliferating and invading the dermis and hypodermis layers. As I mentioned, it is slow growing, doesn't often metastasize. 99% of the cases are a simple surgical excision. And where are you likely to find these? These are likely to occur in your sun-exposed areas. So, for my outdoor workers, that's typically going to be your face, your hands, your neck, your arms. However, if you're an individual who tends to work outside, or let me phrase that, be outside a lot, and you have, well, you're a male presenting individual, so you're running around without your shirt on. Your chest and your back are also prime categories then. Or for my more feminine presenting individuals, if you're running around in a bikini top or a tank top, any of those surfaces that are more exposed to the sun on a regular basis, those are your areas that are more prone to getting your basal cell carcinomas. Squamous cell carcinoma, on the other hand, is going to arise from the keratinocytes of the stratum spinosum. Squamous cell carcinoma, we're worried about your scalp, ears, and lower lip here. So I mentioned with our mole checks, we want to make sure we're checking the mole or the scalp. This is why. This is going to grow rapidly and metastasize if not removed. However, prognosis is good if treated with radiation therapy or removed surgically, especially if it's found quickly, because unfortunately squamous cell carcinoma is fatal, possibly, if it metastasizes to the lymph nodes. Anytime cancer metastasizes, it jumps those fatality rates up enormously. And then we have melanoma. This is the big bad wolf. This is the cancer that we started the campaigns for about mole checks. It is a cancer of the melanocytes. It is thankfully the least common, even though it is the most dangerous. Highly metastatic, very resistant to chemotherapy, typically arises from a pre-existing mole. Mole checks. Treated by a wide surgical excision, accompanied by immunotherapy. Why a wide? Typically, let's say this is the mole. Okay, this is a normal mole here, but let's actually, no, we have a malignant one right here. So this mole, it's not going to be just around. They're going to cut out a huge swath around this mole. They're going to take out a large chunk. Why? They want to make sure that they get all of it. This is not a well-margined cancer. It has very finicky margins. So they take a huge chunk to make sure they get it all, since it is resistant to chemotherapy. Now, unfortunately, the chance of survival is poor if the lesion is over 4 millimeters thick. I want you to pause, find a ruler, and look at 4 millimeters. It's not that thick. As I mentioned, we have an A, B, C, D, and there's also an E actually to this rule. Symmetry, border, color, diameter, and depending on the book you're looking at, evolution or elevation. Typically, a mole should be symmetrical with an even border where you can easily tell where the mole starts and the mole ends. The color is usually going to be consistent throughout and smaller than 6 millimeters in diameter. Here are examples of asymmetry, border, color, and diameter. All right, burns. Burns are divided into degrees. We have first, second, third degree, and actually there is also a fourth degree burn that is not mentioned here. First degree burns, those are the burns most of us think of as burns. It is the epidermis only. Typically, you're going to have localized redness, swelling, pain. This is your your typical sunburn. Second degree burns are the epidermis into the upper dermal regions, mimicking the first degree, but along with our redness, swelling, and pain, we're going to have blisters. If you have a blistered burn, it is a second degree burn. Third degree burns, entire thickness of the skin is damaged. Burned area is going to appear like a gray, white to a cherry red or black color, depending upon the exact tissues, how far down it goes. There's no initial edema or pain because your nerve endings are destroyed. You know how I hate to say this, but movies, they'll be like, oh, someone will go, you're injured, and they'll be like, no, oh, hey, look at that. Some of that is shock, adrenaline pumping. You're not feeling the pain yet, but some of it is, depending on the injury, specifically third degree burns, there's no nerve endings, so your pain receptors in that region are not firing. Now, with anything beyond a third degree burn, we are in danger of dehydration because we have, no skin, no protective covering. Fourth degree burns, the one not mentioned here, is when we go completely out of the skin. Fourth degree burns are typically categorized as being through the muscle, potentially all the way down to the bone. So if I have a burn and I can see the bone at the bottom of that burn, that is a fourth degree burn. Here's one thing with burns. As we go up in degrees, your risk of infection increases. The greater the area of burn, which is what we're about to talk about next, also increases your risk of infection and or death. So how do we determine area? We use a thing called the rule of 9. The rule of 9 helps us estimate the severity of burns. If over 5% of your body has second degree burns, or 10% of your body has third degree, or if there are third degrees on face, hands, or feet, these are all considered critical. Obviously, if we have fourth degree burns anywhere, those are also critical as well. What is the rule of 9? Your head is 9%. So if you have burns covering your head, all of your head, that's 9% of your body is covered in burns. The front of the arm is 4%, the back of the arm is 4%. So each arm is a total of 9%. So if you have arms covering your entire right arm, that would be 9%. Your chest is 9%, your abdomen is 9%, the front of each leg is 9%, and the back of each leg is 9%. And the upper back is 9, lower back is 9. So if I have burns covering the front of my leg, I am at 9%. If it's covering my entire right leg, I'm at 18%. Coming back up here to critical. If those are third degree burns, I am in critical condition. Even if it's just my entire left arm is in third degree burns, I am basically almost at critical condition. A lot of times they'll just consider it critical. So this is a quick, snappy way of going, okay, this patient has approximately blank percent of their body covered in burns. Because in burn situations, especially if it's an emergency situation, you have an EMT who's trying to communicate with a ER doctor. We need rapid ways of getting information and telling them information. So rule of 9 is for that. All right, just finishing it off, development aspects of the integument. Epidermis is going to develop from the ectodermal layer of a fetus, while the dermis and hypodermis are going to develop from the mesoderm. This is understandable when you consider the tissues involved. Epidermis is epithelial, dermis and hypodermis are connective. A fetus is going to have a downy coat of delicate hairs covering them called the lanugo. And the vernix caseosa, it's a substance produced by the sebaceous glands that protects the skin of the fetus in the amnion. That's that cheesy looking like substance that infants are born covered in, that they're then cleaned off of, which most TV shows and movies conveniently don't show. But it looks like almost like a cheesy type substance. Skin and hair, as we go from adolescent to adult, is going to become oilier and acne will It says may, but let's face it, 99.9% of individuals are going to deal with acne at some point. About the age of 30, this is when your skin is really going to start to show the effects of environmental assaults, sun damage, stuff like that. Scaling and dermatitis are also going to become more common as you get older. So if you have psoriasis, if you have eczema, if you have any of these types of conditions, it's just going to get worse as you get older. So finding a way to control it early through lifestyle changes, medications, diet, whatever the case may be, is really, really useful. Once you become what we classify as old age, typically this is the age of 60 to 65, although 55 is a pretty frequent standard as well. Epidermal replacement of cells is going to slow down. Your skin is going to become thinner, dry, and itchy. That subcutaneous fat layer is going to diminish, leading to an intolerance of cold. There is a reason older individuals tend to complain about the cold so much. They literally lose the subcutaneous fat layer that's helping to insulate them. We're going to have a decrease in elasticity and a loss of that subcutaneous tissue, leading to the formation of wrinkles. We're going to decrease the number of melanocytes and Langerhans cells, increasing the risk of skin cancer. So your risk of skin cancer, especially that basal cell carcinoma, increases as you get older. And that is our brief walkthrough through the skin.